This. Like this.
Okay, so I'm actually okay.
So your face will be captured from this video, and then the presentation.
Okay, but as in I'm also presenting from my actual, because my actual slide have video on that.
Oh, I see.
So
Hmm.
I'll actually be presenting like this.
I see. Maybe you try to go to the present again and share screen.
Okay.
I think present share
Share
screen.
screen. Screen sharing.
Does that work?
No. Yeah, ready? Okay. Yeah, yeah. So who? Oh, okay, let's start. We can come in and start. Okay, does this work?
Yes, it works.
It works.
So it will be like this. So your screen will be shared like this.
Okay, then how do I move? Oh, okay. So I'm doing this now.
The subjects actually, if they want to join, they can join.
No. Just number and yeah.
So we know the points of the
Yes, yes. So I think Deepak has to go earlier. What time you need to go back? Yes, yes. Okay, so he will go first, and then after that my subject will be second, which I think Dr. Linda will be doing. And after that, the last will be for Dr. Jerry's subject. Dr. Yeah, no,
no,
okay.
no, just here, just observe.
Okay. So how do I move the things? I can't.
You can just share screen then.
Okay.
You just share your screen and then do whatever you want to do with the
Okay.
screen.
Like this.
Yeah, it's actually moving. You can next.
Okay, you know what? Never mind. I'm just going to go. Okay.
Okay.
Okay, so let me just do quick formalities.
Yeah.
So we're very thankful today to basically have Dr. Bernard to basically help introduce SecretDUO and to basically have a workshop on how we can do it for good skin rejuvenation. Okay. Dr. Bernard is actually one of the key users for SecretDUO for quite some time now, even in his previous
More than a year.
Right. So he's definitely very experienced. I think today we can learn from him. Okay. Thank you very much.
Okay, everyone, thanks for coming down. A moment now. Okay, so I think today the sharing session is about the SecretDUO. It's a RF microneedling device combined with a erbium glass non-ablative fractional laser. So I think this is the latest generation of the well-established Secret RF system, which has actually been in the market for about 10 years or so. Yeah, quite a while. And so today, I think what we'll touch on is RF. What is RF microneedling? The users of it, and the kind of indication and how I put it in my practice, because we also have lasers, we also have and we also have injectables, how it ties in and what I use it for. Okay, so let's just skip the. Okay, so I think this is a really good paper published in 2019 that kind of summarizes RF microneedling, and basically what is radio frequency. So it's actually a misnomer because actually it's not a radio wave nor electromagnetic wave, but rather it's an oscillating electrical current that when passed through tissues generates heat. So it directly converts electrical energy to thermal energy to cause tissue heating. So in medical usage, actually this has been in use for quite a while. In the hospital they use it to ablate tumors or they use it to tighten tissues. Yeah. And so in aesthetic use, the history of RF actually dates back about 20 years. The first RF device that was approved was the Tumor, which now we know as the March, which was an RF monopolar device that that actually pass electrical current through the skin of the skin of the patient, and the electricity will go through the ground electrode attached to another part of the patient, and this block heating of the skin. So it kind of looks like this RF monopolar device, and it's still in use now in the fifth iteration. Uh, but of course, the limitations of surface applied device is that there's a very high risk of burns of epidermal of pigmentation, because on one hand you need to achieve heating of at least 40 to 42 degrees Celsius for new collagen to be formed and for existing collagen to tighten. But at 45 degrees, that's the threshold of developing epidermal burn. So even today, 20 years later, the march is still, I mean, the still users still face the issue of burns because of that. So then comes, so after that, later on lasers came along, and for lasers, you would actually, so the thing about lasers is that it updates. So initially, they start off with a full field of lasers that update the entire field. I'll show you a diagram. Mm. So initially, maybe 20 years ago, they started full field ablative lasers, and about 10 years ago, they start moving into fractional ablative lasers. And while this can give good results, it also comes with significant downtime of over a week. And as in darker skin types, there's also quite a high risk of post-inflammatory hyperpigmentation. So because of that, it's currently falling out of favor. So this is where microneedling RF comes in. Basically, to achieve rejuvenation or to achieve the goal, you need to do several things. You need to heat up the collagen to at least about 65 to 70 degrees Celsius. And the collagen target will be in the deeper layer of skin, the dermis. At the same time, you need to spare the epidermis. You need to minimize damage to the epidermis, because if you compromise epidermis, you get problems like internal pigmentation. So, microneedling RF has more or less successfully managed to achieve that goal by penetrating. So the needle penetrates to preset depth and emits RF heating at the deeper layer of the skin, and you only get an epidermal puncture wound. The needle can be insulated so as to so basically you achieve a very a candlestick-like effect, with the most of the energy being delivered to the deeper parts of the skin, while part of the skin remains cool. Okay, so that's the theory. Then of course the urban gas laser is more tightening laser. It heats up the skin in columns. It doesn't affect the skin, but it just tightens the skin. Okay. So let's talk about. Okay, so this is what it looks like. A skin biopsy. This was a study that did a skin biopsy in abdominal skin in patients who were about so basically, you get this common of sub-ablative heating, where the existing collagen is tightened, and and also so in the short run, basically you get a wound healing response when there's increased inflammatory cells. The skin the collagen and deposit new collagen. And this process takes place over the next 4 to 8 weeks. So you can see some immediate lifting, but the full result takes about 1 to 2 months to be seen. Okay. And then, okay, so I think it's when we are treating the face, we need to know the thickness of the skin such that we can uh, basically you can still run into problems even though it's a generally safe treatment. And the potential problems that I would warn patients of are number one, infection. You can, I mean, the skin is open, you can get an infection. Number two is you can get pigmentation, post-inflammatory hyperpigmentation, or even just a bit of redness around the needle entry sites. That we call it grid marks. So those are fairly common, and I mean, it can be quite upsetting if it lasts more than a week. Okay, so these are the tips for to optimize the treatment. I don't treat distressed skin, so if there's a sunburn, there's an active acne, there's an active infection, I would treat it medically first and defer the treatment until the skin condition stabilizes. Uh, number two is you need to, I mean, of course, this comes with training. You need to know each part of the skin, what depth and what power setting to use. And of course, there's I think that the factory settings recommended by the manufacturer are fairly accurate, but of course, you can tweak it as you go along once you get more used to the treatment. Then of course, we disinfect with chlorhexidine and and okay, so to prevent grid marks and to prevent grid marks or to how does this happen? So I think one of the grid marks would be improper depth of treatment. So maybe you set at 2 millimeters, but when you press against the skin, maybe your contact is not good or your handpiece is at a certain angle. So the energy is not actually delivered to 2 millimeters deep, delivered to maybe 1 millimeter deep. So it's too high for that depth, and then it causes a localized burn. That's one pitfall. So the handpiece needs to be perpendicular to maintain a good contact. And number two is we see with all microneedling devices, which is you shouldn't drag it along the skin. Because especially when you get more used to it, you try to go at higher firing rates. The impulse is to drag it along the skin so that you can speed up the treatment. But if your needles haven't fully retracted and you're dragging it along the skin, you could scratch the patient and then you get a scratch marks that take a week or so to heal. So that's another pitfall. So, later we will demonstrate the slip completely before delivering each pulse. Then the next is, I think other tips would be, I usually perform 2 passes, but I rest the skin. I do not stack pulses. Stacking means you hit the same spot twice. So obviously, I mean, if you hit the same spot twice, the area of skin will increase the risk of complication. So what I do is I make 1 pass, and then I mean the treated area will do it, and my second pass I'll just touch up the areas that I missed. Okay, and in darker skin types, I would usually use the power settings, like probably skin types 5 and 6. I would use the power settings, and of course the aftercare is also important. So the patient needs to adhere to strict aftercare for the next 3 to 5 days to optimize the treatment. Okay, so let's go down to the slide. Okay, so we'll zoom in a bit more to talk about the SecretDUO. So as I shared earlier, I mean, how it's different is that it's not only an RF microneedling, but it also has an additional skin tightening laser, the non-ablative laser of 1540 wavelength. And so I think it complements each other because the RF microneedling obviously penetrates deeper, and the laser seems to help to tighten the epidermis and more superficial. And these are the indications. I would say that of course, in the setting of aesthetic clinic, the main indication would be rejuvenation, and of course, acne scars. These are the 2 major indications. But I also started using it for eye bags, droopy eyelids, and on the body, I am using it for stretch marks. And it can also be used for cellulite, and some people do use it for hyperhidrosis, but I haven't got that much yet. Okay, so on the armpit, I think palms I suspect will be very painful, so I wouldn't recommend it. Yeah. So the device comes with a variety of tips that are catered to different use. So on the face, you'll probably be using the AC25 insulated and non-insulated tips, or the AC10, which is a 10. Basically, the number represents the number of needles. So basically, mainly I'm working with AC25 non-insulated. So the handpiece treats a 1 by 1 centimeter area, and there's 35 little pins. So if you the AC10 not so much, because I can find that the AC20 can get into most areas, even around the eyelid. So there's no need to change the tip, which will incur more cost. Then for the body, they recommend using the AC64, which is about 2 by 2 centimeters. It's a bigger area. There's more needle pins, and the maximum penetration of all these can go up to 3.5 millimeters. So on the body, you might be working with deeper depths. Then another thing that I think is unique to the CIF system would be the handpiece, basically the cannula handpiece, which allows you, yes, you can see on the right, which allows you to perform very localized treatments, which I'm currently using it for RF powered subcision of very deep acne scars. I think we might have a subject later. Basically, as compared to the traditional subcision where you get a lot of bleeding and bruising, the RF subcision lets you cauterize right away. And for very tough scar bands, it
helps you to cut through, so it cuts through it more effectively. I think it's a good adjunct to your traditional subcision. And I mean, I've done a couple, not that many, but I mean, I know that I can see the difference immediately. There's less bruising, there's less swelling. That's good. And there are some hand pieces that can be adapted or used for direct eye bag reduction or double chin reduction, but that's not really the scope of today's talk. Okay, so as I said, acne scars, that's one major, this is my treatment for acne scars. Two is for rejuvenation. And I think what is unique about this device, of course, there's a lot of things you can do for rejuvenation, a lot of machines, energy-based devices. This is my device of choice in big areas, neck rejuvenation, if we want such indication, and double chin. Around the eye, because around the eye, it's not safe to use laser, and it's not, I wouldn't want to use maybe ultrasound-based devices too close to the eye. But I find that with this device, you can control the penetration. So I am using it for my eye bag and my mouth eyelid cleaners. Okay, then on the body, I think this is really good for stretch marks. I mean, I'm going to try out with cellular and hyperhidrosis soon. Okay, so this is a video on how it works. Okay, so so the downtime is actually not too bad. After the SecretDUO treatment, there's quite a bit of erythema swelling, and I would use with growth factor media. Obviously, I use TMT, not perform locally. So I use a stem cell condition media containing growth factors, and I shine an LED for 13 minutes. Within 2 to 3 days, it's more or less back to days time. Okay, so fairly fast. This is what it looks like after a tummy treatment. But point is, more or less within 2 to 3 days, you're back to which is faster than average. And later and the other thing is the interface is also quite intuitive. Later we'll go through it. But there's not a lot of things that you need to play about. You really have to just like the depth of treatment and the RF energy you want to deliver. And that's really the main things that you can decide. So there's not too many things to remember. And I would say the factory given protocols are fairly accurate. Okay, so these are the protocols that will be provided. I work with them, that are fairly accurate. Okay, so I usually recommend 3 sessions. I space them a month apart, and I will just advise patients for about 2 to 3 days of downtime. And it's very similar to laser treatment. So avoid the sun, we use a sunblock, and avoid skincare that cause irritation. So avoid phenols and acids. But I think light makeup is okay. I don't prescribe an antibiotic. You can consider using an antibiotic, but I have not found it to be required. Then of course I will consent them for infection of itch and grit marks as well as burns and scarring. Okay, so we're done with the treatment. We're done with the presentation. Any questions before we proceed to the hands-on? I've done, and I would say that I think it's probably not so good to do it for aesthetic because the bruising and swelling lasted 2 to 3 weeks. Yeah. So I think that, and I think anyway. So now for eye bags, I am moving towards just with 3 sessions of eye focal healing. Okay. Okay, so let's head to the hands-on. Okay, so
I need to fasten to carry this. I will need to fasten. Angeline.
Thanks for coming down.
Maybe you want to choose.
I'll just run you through the interface, the user interface. It's a fairly fast screen, and I'll teach you how to set it up. Okay, I'll show you the interface. Okay, okay. So the interface is quite easy to use and quite fast screen. Basically you get to choose between RF, the laser, and smart. Your smart is the cannula. Okay, so select RF. So this is the FP. It's quite small. It's quite easy to use, and we'll take sorry. So this is the new cartridge. This is a AC25 non. So as you can see here, there's a sort of a groove, a big groove and small groove. There's corresponding grooves on this on the needle tip. So you fit it in, and then you twist. And when you twist it, if you're locked in, the light will change and it will detect. Okay, so this, because it's needle tip as blood product, so every needle tip is single use, or I mean, if basically these cannot be used for different patients, because there's exposure to blood products. Okay, so now that we are in, this is what the interface looks like. So as I mentioned, intensity, you can go all the way up to 100, but I think most of the time we're looking with between 30 to 50% RF intensity. I've never exceeded 50%. The usual factory recommendation is between 40 to 50%. So that's for intensity. So I would say somewhere between 30 to say, you need to go above that. Then the next thing you need to decide is the depth. So so there's also a little bit of estimation. You need to sort of estimate, but I would say in general, the lower face and the double chin area, you can go between 2 to 2.5 mm. Then when you get to the upper face, I'm working at upper face and then I'm working at about 1.5 mm. And then for the forehead and the eyelids, right, around 1 millimeter is okay. But of course, you kind of vary. Like in a man, you can probably increase by a little bit. In a woman, you can decrease by a little bit. There's a little bit of variability. Okay. So yes, the next thing you said is the depth. And then the next parameter is RF time and delay time. So what that means, RF time is the amount of time the RF energy is on the cook time or the activation time. And the delay time is the rest given between RF energy pulses. So the very simple number, your depth is your depth in millimeter just corresponds to your RF time in milliseconds. So example, if I'm working at a 2 millimeter depth, then I will just work with a 200 millisecond RF time, and the delay time is double of that, so it's 400. So it's pretty intuitive. So let's say at 1.5 mm, my RF time will be 150 milliseconds, my delay time will be 100. So it would just it's a rule of thumb that is fairly accurate. That was suggested by the manufacturer. Then the next would be mode. So the mode is basically tells you the time in between shots that are fired. So it's basically how long we have to get into position for the next shot. So example is, let's say I set the mode to 1 second, I fire. If I'm stepping down, right, as you can hear, there's a long 1 second delay between the pulses. Okay, and let's say I'm a bit more experienced, I will set at maybe 0.2 seconds. So when I fire, as you can hear, so I have 0.2 seconds to get into position for the next shot. And but of course, if I don't get in time, then I miss burning the patient. And if I rush and I may scratch the patient. So I found that about maybe 0.5 is a reasonable duration. You have half a second to get in position for the next shot. Okay, so you can probably start at 0.8 and then get down to 0.5. Faster than that, it doesn't really work out. Okay, so this is what you have to set up. So it's pretty simple. And to make things even more idiot-proof, you can save your presets. So as you can see, I have 3 presets here. So preset 1, this will correspond to what you're working at. So my preset 1 is my deepest layer. So I will always start with the lower face. So my preset 1 is a deeper depth, higher power. Then as I move up the face, I go to preset 2, which is 1.5 mm depth. And then when I work on the eyelids, when I work on the eyelids and forehead, then it's preset 3, which is even lower power and lower depth. So you can work with the preset, so it's even faster. You don't have to keep changing. So once you get quick, you can probably get everything done within 15 minutes. So it's quite the turnover is quite good. Okay, so that is for RF. So the next one would be a skin tightening laser. So basically, this laser you work with the energy settings. So the recommended is 13.2, but you can go up to about 15. I mean, you can play around a bit. Then the distance we usually set at 1 mm. And then the mode is the time between shots. Okay. So this fires a preset grid of about 1 by 1 cm. So when you stand by, it looks like this. So when you put it on the skin, you are heating up the skin in this 1 by 1 cm grid. Okay, and I mean it's and then okay. So there are several ways to deliver. You can do point by point, or you can do this thing called eye motion, which is a continuous fire. You have to move the hand piece. But I prefer to work point by point, even though it takes a bit longer. I find it gives a more even distribution. I'll demonstrate both later. Okay, Ken. So I think we are ready for our first subject. Yeah. Okay. What's your friend's name?
Laura.
Laura. Okay. So probably actually you've done once before. You want to get to it. Okay. So I think you can do the treatment for her then. Or maybe I'll just demonstrate. But I'll do half the face first. Half the face. Why don't you have a seat? I'll just explain to you a little bit about this secret RF treatment. You've heard about this, probably you've done some reading.
Oh yes, so much reading.
Okay. And you've done any RF microneedling treatments before.
I've done my.
Well, okay. Have you had any cosmetic treatment in the past 3 to 6 months?
Yes.
What happened? BBL, okay. So no injectables and tests, and you have no implants in your body, no that I need to know about. Okay. So I think implants is something I would check for, cause I mean it's electrical current, so.
But I did do a little bit of Botox within 6 months.
Okay, that's fine. Yeah, so I think I'll check for implants. I'll check for previous injectables because theoretically, this could destroy an injectable. But I mean, we're usually looking at a different area. But I would, so if I'm doing this with injectables, I will do this first and injectables later. If they had a previous injectable, well, I would just tell them that theoretically it could affect it, but I'll be avoiding it if possible. So it's a bit of gray area. No one really knows. Okay, but if possible, generally I try to do the injectables after. Okay, so it was about 6 months ago. Okay, so long gone. 2 months ago. Yeah, that's okay. Long gone. Okay, so after this treatment, we're doing a RF microneedling treatment with a laser. For you, we're doing it for rejuvenation. So we're gonna aim for some skin tightening around the face, the eyelids, plus the neck. We're gonna expect about 3 days of skin redness and a little bit of tightness. And in that 3 days, you gotta take care of your skin. No, we try to avoid direct sun exposure to sunlight. Maybe don't go for any saunas or schooling, and you might have to change your skincare later. Things that cause irritation like vitamin C, acids, and retinol need to be stopped for a week. Okay, but if you need to put light makeup, that's okay. Then we'll get started.
Can you focus on the acne?
Okay, I think I got yeah, you've got a little bit of yeah, you've got a little bit of acne scars, and I mean, of course, some fine lines, especially around the eye. I think the tan recently, I'm seeing something on your neck.
Like,
Oh, it's a spray on.
yeah.
Okay, so no recent suntan, recent lesion. Yeah. So I usually check for recent suntan also. It's just thinking about I think it's better to defer. Yeah. Okay. Okay, so usually I would I will usually work I'll do half the face first, and I will let the patient see. Immediately actually some lifting can be seen. So I'm going to start with the work face, and then work down to the neck, and after that up the eyelids a bit, and then after that the other half. Okay.
So I can see which is better.
It'll probably be the same. But
Pressure for doer.
okay. So I'm okay with reset setting, so it's fairly fast. Okay. And I'm going to buy a test shot. You let me know how it goes. Okay. How's it? Okay. So as you can see, the COR is not. So I mean, it's fairly well tolerated. The pain score is usually about 3 to 4. Those. So like my first class, and then chapter biotherapist.
It's not only.
Yeah, I mean, out of 10, how would you rate this? Maybe 3 to 4. So, okay. Okay. Emily get a vibrator. Yeah. So, yeah. Okay, we can put a vibration device to distract you from the pain. Yeah. So usually, you're familiar with the gate theory of pain control, right? So, I mean, it's basically like your brain can't handle too many emails coming at once. So, if if there's stimuli from another source, that will distract from the input source. Okay, so I'm done with the 2.5 mm. I'm now going to 1.5 mm of the intensity. Okay, I'm going to work along the neck now. A little bit. I'm going to really focus on the loose skin on the jawline. Okay, give you a really tight jawline. So on the neck, there's all these blood vessels, right? I just avoid them. But I've treated over them before. You nothing happens, but just avoid them if you see them in the neck. See a lot of veins. Is it okay for you? The neck
Next fine.
typically is better. So you will notice, look at the handpiece, right? I'm lifting up completely. I don't drag along the skin. You need to lift up completely between the drops so you don't. So I think CRF really shows its value in large areas like the neck because, I mean, it's not like a device where there's a consumable and you're limited in the number of shots you can buy. You kind of, I mean, once you open a new tip, you kind of go as you can convert the area to your satisfaction. So really get under something in the skin. See, so now I get every team. I'm just going to touch up the areas I've missed. Usually I go for 2 passes. Next is another scenario where I would also recommend. So she does have a bit of faint congenital neckline, so I think it's it's good to do. You should treat it from the line. Back to the face. So now I'm going to preset, which is just at 1 mm depth, just for the eyelid and the eyelid and as well as the forehead. I'm going to work around. I've lowered the and then so I'm going to start with the eyelid. Which eyelid? So I push the skin down a little bit, and I put the skin down a little bit, I aim away from the eye, okay, and then we go for 2 passes. So this really helps with the fine lines around the eye that can be a bit stubborn. And because of the accuracy, I'm okay to go quite close. To do the upper eyelid. So I pull the brow up, I aim away from the eye, and then we just. But I don't treat on the eyebrow. I don't want to burn the hair, so I just go right under the eyebrow. On the eye. So the tip is fairly small, so you can get into these kind of tight spaces. Quite okay. Around the eye, wrinkles. Okay, so I'm done with the eye microneedling for half the face. Now I'm going to show you how I use the laser. Okay. I'm now going to do a second laser treatment video. Okay, so as I said earlier, you are treating this 1 mm bit, right? You put the handpiece and the spacer right lightly on the skin, and then when you press down, just like this. So you don't get any ablation, so there's no smoke, there's no the endpoint is just very mild redness. And already after the eye treatment it's made already. So actually what I do is I do 2 passes over the whole face. Okay, I set my energy at 15.6 something. So how did that feel? Just a little bit sharp. It's a little bit uncomfortable, but collagen doesn't come with So for the laser, I don't treat around the eye because it's a laser, so I don't treat around the eye. So this is one part. I'm gonna go ahead about. Yeah, I'll show you the scanning motion. So you can now do the eye motion, right? So what eye motion does is it fires continuously. So if you lose concentration and you linger at one point or even half a second, you will burn the patient. But the advantage of this is that you can cover. If you move constantly, you're painting the whole face. You're like literally heating up the entire face. But why I don't do this is because I find it's a little bit inconsistent. Like it's if you lose concentration, you linger on, you're not going too much energy, and you may burn the patient. And whereas if if you want to get it over with and do it quickly, then there's no effect. So I rather do it, even though it takes twice as long. So you just have to move it in such that it doesn't hit the same spot. Is this okay? So we can always, as we suffer, we can always lower the corner a little bit. And we can always build it up to get more used to the treatment. So I'm going to go your neck. Not the same thing. I mean, it's just move it a little before the next shot comes and cover the entire area. Is this okay? So this second step, the skin tightening laser is not is something that is not included in the original secret IF treatment. Yeah. So I mean you can justify charging more. It's
That's
now I just finished the forehead and done for half a side.
bloody hell.
Okay. Okay, always do it. Okay, well done. We're done with half the side. Let's take a short break. Okay. How are you doing so far? It was a little bit unpleasant at the end. Yeah, because after you treated the area with IF microneedling, the it's sensitive. So let's take a short break. And I think before the other half. Have a look at yourself. Actually, let's see some immediate lifting. You can sit up and have a look at yourself. Because there's some collagen tightening and
I just see that. Okay.
okay. So just hold still now. Okay. So I mean your existing collagen is a little bit tightened. So actually there is some lifting. You can see your line is more shallow. Your half line is less. So your line is a little bit shorter. But of course, the full results will be in about 1 to 2 months after we the treatment.
Because the neck is still
But you can't quite quickly. After this, we're gonna and the witness test will be fairly quickly. You'll see over the next 2-3 days. Okay. And so, can we stop there?
Yeah, I think I'm done. You feel good at this?
Okay. So let's go back to you're still on the label. Yeah. Then you can just reset whatever. So as you see, 2.5 mm, 50%, and the IF is corresponds to the Z. And you wanna we'll give a little bit more time until you get the answer. So you see, it looks a little bit awkward. So I will usually hold it with my left hand when I'm treating the left side of the face. Because when you're doing this, it looks a little awkward. And on the other case, you can add to turn a little bit. I just turn a little bit here, right? Then it makes it more ergonomic for you. Yeah. Great. Yeah. Good. It's too fast. Yes. So can go a little bit faster. And then you just see so the spots you hit turn red, right? So you aim for the in between the white bits that you
Just the white bits.
yeah. And usually then you sort of achieve a target.
When you double chin, you're saying that.
In, okay, if there's a really big double chin, I would go for it. But hers is not really, just a bit of squeeze skin. So I decrease. I go to preset 2, which is 1 and then 4%. And then with this, I would treat upper cheek as well as the red. And the nose. So. So I just point out something. You're experiencing lift off, right? So meaning why you're experiencing lift off, sometimes over bony areas, the skin's a bit thin. And so the needles penetrate, but they don't go into the design step and rather you can do your handpiece back a little bit. So that is where you have to be careful because you can deliver to them. So you no, I think it's okay, but you just have to be you just take your time and get a firm contact or perpendicular and then you enter. Because sometimes, especially around the cheek area, the cheekbone area, you get the forehead area is thinner. So you just have to be aware of that and slow down a little bit and make sure that you can do that. You also sometimes in the second half of the treatment, the needles get a little bit blunt, so they don't slice through as smooth as they should. So that's why you get lift off. So you just be aware of it and slow down and you'll be okay. You can do the next one. Yeah, so that's why I usually change to my left hand because I mean it's get a bit awkward. Just have to get used to it. You can't. For the leg, just look out for vessels and just even some space. And I mean that's the only thing. And over the midline, the track, yeah.
go to the eyelids and forehead, and then and you're very honest, okay? Should I? You want to increase the time frame here. Because at lower depths, your RF energy emission time is lower, so it feels faster. You have less delay with the shots. And try to get good contact. Contrast this. It really helps with the pause and the glabella region. Okay, so again, you just try again. Move up to the laser. Maybe you lower the energy a little bit. Yeah, I think she wants it a little bit.
But then is it going to be better on that or not as good on that?
To be honest, I feel that RF microneedling does like 90%. Laser is just popping off. So point is, I think the most of the what you needed has been done. We're just doing a little bit of smoothing. Bilateral. I need this is it this and this the laser secondary actually we don't yeah, we're great. Okay. All done.
Thank God for the plan.
Okay. So you mean we take a picture of her with her skin the red now. It looks pretty red now, but it goes away fairly well. Okay. Which is good. Yeah, no, what say now? We begin to check that we also recommend adding stem cell, but I mean the LED light is usually incorporated the stem cell treatment, the stem cell treatment is something optional. We can consider. Yeah. I'll take a photo first.
Yeah.
Photo. Now and it goes away fairly quickly.
Thank you.
How was Jesus recovery after that time? Fairly quick. It looks pretty weird initially, but I mean I was impressed by how it fits all more or less. Yeah. So it's a I think she said those. Okay, okay. Can. Okay, see you. Okay, oh, it's selfie with us. Okay.
Just wanted to start around here watching.
Yeah. Okay, great. So the next subject is, I mean, it's a regular kind of mine, Acne class. So I'm going to demonstrate RF powered substitution, and then I think maybe do the. Is it common that it's a little bit pinpoint bleeding? I mean, sometimes but bruising I haven't encountered yet. But usually pinpoint bleeding is very fine. I just put with press and cross. It's done in like 10 seconds.
It's not because the way I put the pressure.
I do encounter. I mean, I think with all needling treatments, it may happen. I mean, but I haven't had a major issue. It is the pressure is gone. I haven't. So we did this treatment about maybe a month. Yeah, how was your experience? The previous time. Okay. Okay, and how was your recovery? 3 to 5 days. Okay, that's good. And do you see any improvement?
I think my pores were larger previously, so it's already smaller.
The extra, you were much deeper. You were much deeper. Now, in fact, I do because they used to be quite depressed. I subsidized both cheeks and they are lifted up now. So now it's more a matter of polishing already. So one session. One week. Yeah. I mean, actually, so usually the general, and okay, out of 10 points, how would you rate the pain from the previous session? Out of 10.
4, 5.
So I mean, there is discomfort, but it's usually within acceptable ranges. And I mean, not bad for you can see results in even one session. Usually, I would advise, if she was my client, I would advise 3 to 5 sessions. But usually, even after one session, you can see some. Okay. This is a new one, or this is the old one, right? Put it aside first. You can open the new one. So anyway, yeah, I'm not going to do surgery, but because I think I class improved a lot. So we just use the. So I think about 2 senior doctors I don't think they perform the treatment, but I mean they are quite experienced, and I'll also be working with them together. That's clear. Okay. And your face is flexible. That's it. that's not perfect. You want to do this? I mean, it's quite simple. Like, just match your thing, please. And then the light will change. If it doesn't, if it's not, it will tell you. It will just tell you. Right. So, so just because it's a new one, this is the one. And then, so there's big and small. You just match the edges, and then you twist. Okay, so safety tip: you don't ever touch the needles come out from there, so don't ever touch. Don't touch the front. Okay. So yeah.
I think it was next just to start like both
So this is big. This is big.
yeah.
Okay, so try it. So you match the edge is here. See, there's a big edge. There's a big edge here. Small edge is here. Small edge is here. So you match it with this. And just watch this first class and just come down. And then you see your face. And then when it's in, it's a bit loose. It will just say fish channels. And yeah, just watch this consistent. Yeah.
We're just for those small facing the bar. This is very white.
Yeah, or we can just I mean okay, you set yourself up how do you want to plan for I mean you see your skin, how do you want to plan for so I mean the general advice is the lower face and especially like these guys like 2.5 millimeters. Then the mid face the most important the next is 1.5. Then around the eyelid and the forehead 1 millimeter. Yeah. No, this area, the lower cheek and the acne scar area, about 2.5. Then but she got her acne go quite high, so about 2.5. You can try maybe 2 mm, because or on one hand she's also a lady, so you should use a bit. So you can try 2 mm for the lower face. Then around the mid face and the neck is 1.5 and the nose 1.5. Then after that, I go up to the eyelids and the forehead, I go to 1. Okay, then power also low face, the deeper you go, the more power you can use. So you can over any side you can power 50%. Then at the 1.5 mm that I'll be doing 40%. At the 1 mm that I'll be doing 30%. So you can try setting it first. Set the depth first that you want. Yeah, you can go with 2. Yeah, you can go with 2. There's a bit of estimation also. Okay, then intensity you can go maybe 40% in states. Yeah. And then RF energy is always proportional to the depth. So it's 200, it's always the same digit, so it's 200 milliseconds. And then okay, and this is double. The delay time is double, so it's 400. Delay time is always double of the RF energy. So it's 400. Then the mode, is the so single means you fire one shot, you stop already. So if you just want a delay, yeah, usually set at 0.8. 0.8. Give you a delay shot. Can you just see? You can go. Okay, press ready. Yeah, I usually start at the lower face. And then after that I'll start here, then after that I'll do here and here in the neck. And finally the nose. Yeah, 1.5 that low. Do a test shot just to do that. Okay, I'll do contact first, then use that number. So the thing is used to be perpendicular. Sometimes if you are a little bit angled, right, then some of the needles are not getting to the inlet there. Yeah, so perpendicular. And also be systematic. So you want basically you aim to cover the whole area twice, right? So usually I start from bottom up and then I start from bottom up. Then that way you cover all the area and the skin at a little time depends. Sorry. Yeah. So you now you treat the fetish parts where you haven't treated previously. Once you wait, you can do it alone. Sorry, can do a bit more of the cheek area. Yeah, because it's still a bit like this. No, this area is good also. Please do this area also. So, yeah, okay already. So now we'll move on to the more shallow depth. So we can put on standby. Then you just adjust your settings. So you can adjust the depth to 1.5. We can put at 1.5. And then the power can the RF you can use because when you use the depth, you need to reduce the duration of RF energy. So 150, 1.5, 150, and then this one 300 double.
Is it better to do same setting?
Yeah.
Change setting.
I find that because mine is preset, right? So I find that I keep it on my hand. I treat it quickly, it's very fast to change. Then I always treat one side first, then I change then like so if you use your right hand to treat the left side, right, your output is over the patient face. So I don't like that. So I just change. Yeah, so I just change hand to make it more less
So
forward.
that's why you feel like that. But actually by one setting you could actually practice.
So I mean, whatever makes it fast for you, the idea is to it is flexi, but I mean because I treat that I quickly hit the preset, then I change. Okay, so now, so now at this 1.5 setting, the nose and treat the neck. Yeah. You treat the neck first. You turn a little bit. Yeah. You comfortable? Why don't you treat while sitting? If not, you get a back aching. Must need to be ergonomic. Oh, yeah. Then usually the vessel I don't. Up to you. Up to you. But I avoid the rest. So that's all.
Yes.
Yeah. Yeah, make it very. Yeah. Okay, so far. Usually it will be now and then, so you don't have to go into the second. Yeah, among the noise that goes, so because you really tighten the skin at the submental area. Okay, okay, now you got used to it, like, now you, okay, now you got 0.8 second delay, right? You press down and hold, then it will fire every second, then you kind of get the timing right, and then you don't have to keep stepping before you straight. So just step and hold, and then move your step and hold and move the head piece. Keep the timing. Yeah. You don't have to keep stepping every shot until you got the piece ready. See the over the trachea like your skin. Don't pass, don't pass. I usually
Do 2+.
yeah, just 2 pass, and then if you come out face, then you can yeah. Darker skin type. So the lighter, like you do for darker skin type, they actually turn it, but it's not so obvious. Yeah.
What the face red, but it's not red.
I mean, it's a bit darker skin type, so it's not so obvious. It's more obvious on lighter skin types. Yeah. But I mean, it fades faster.
That's not the other
Mm. But later we will see her again after yes. So now we can do the nose, and then we after you. So now what I will do, like I'll do the touch of the face. You need to spots. I will just use the 1.5 ml touch the face. So that is even. Yeah, we do the touch of the face first, then we do on the nose, then you do the eyelids, and then there's still the laser. After that, we
Oh, so after this, here, actually there's something to.
does it. You can just use the 1.5 to touch the white spot. Yeah. The patient on numb already. Sorry? Oh, she's leaving now. No time now. Okay, that's fine. So the nose, right? Another tip, okay. So the nose, sometimes you press down the nose will move, right? So sometimes I use one hand to stabilize. Then I stabilize and then because the nose will shift, right? Then I stabilize with another finger, then so that you can, and the nose is thicker, so sometimes it doesn't penetrate well. So you just stabilize the nose from the other side, and then you can. And so don't put yourself around the nose, first the fingers. Be careful. Okay. So now let's adjust to the eyelid and so we use the depth to 110. Power can reduce to 30%. So the intensity reduce to 30%. And then 30%. And then the intensity RF duration 100 milliseconds. Yeah. And then yeah. More, maybe you give yourself 0.8 seconds between points. I see. Remember the depth, right? Then the RF energy corresponds to the depth, right? 40%. Yeah.
So around here.
Usually, the deeper you do it, more energy you can deliver. So the energy typically is between 30 to 50%. So just remember, the deeper areas or thicker skin, you can give more energy. The thinner skin one, or maybe first time when you drop the energy, up to 30 to 40%. Yeah, start. Okay, so what I did, right? Your spare hand, you just put down the skin gently, then you can work around the lower eyelid. Usually, I will go to the, I will leave half a cm away from the eye. I don't need so much, but around there, and then refresh the skin. Yeah. You can start from the side first, then you get to the head, then you can go to the inside. Okay, so you it's faster, right? Because your eye time and your delay time is your eye time and your delay time is shorter, so the pace is faster. So you activate this pace. So yeah. So I should do two passes, so you can go on the round until it turns the way. Okay, but yeah, total two passes. You can do the forehead first. I'll do the forehead first, and then you. Okay, do the forehead first and try to touch out the eyelid. Yeah. Okay, don't go so close to the hairline because sometimes the numbing you don't numb at the hairline, so there might be a spot where you don't numb. So you give the hairline about half a cm buffer also. Yeah. So just touch out the spots that you missed, and then touch out the spots that you missed, and then. So the pressure you refer, but don't need to press too hard on the eye also. Okay, now do that. You want to do the upper eyelid one? Okay, do the. So, okay, so I so yeah. So now I will touch up I will continue to touch up the face because some yeah no and also some patients they are quite observant lah, so you don't want them to go home and say, hey, so just touch up and make sure that everywhere you know. I mean, the outline of the square marks is more obvious if there's areas of white. If everywhere is red, it actually looks okay. So, I mean, a common, yeah, after this is a spot. So, just touch up. There you go. Yeah, so I'm gonna increase touch up the lower face with the, I just increase it a little bit. I touch up until there's no spots. Okay. Yeah, and just touch up the neck also. Just make sure there's no empty space. But avoid the vessel. Yeah, okay. more or less very even. Okay, you put this. Now we got the laser. Yeah, I put this level in this one. Go back. 100. This one, this middle one is 1540 is the weight laser. This is the laser. Yes. Then I set the energy a little bit on the lower side. I think some people are having a bit. But this is okay. It's still okay. Then you just need to stand by. You said higher. Yeah, this one is okay. 10.8 is okay. Set 50. A bit higher. So you can just cut down to 10.8. Usually 13 to 15 is the recommendation, but because it's sensitive, you just cut down.
So it starts from
Yeah, so basically same idea. Just treat every surface area of the face as like
last year.
yeah, twice.
Last year, so start here.
Yeah, what we'll do here, I'll do the face first. Then after that, I'll go to the neck, then I'll finish up on the forehead, which is more sensitive. Yeah. And then the distance is also important. So you lightly just lightly touch your cavity, lightly touch. Because if you leave from high, the laser, because the calibration is off, then you lightly touch cavity. And then yeah, and you just down and then just you can't really slide because of the heavy, so you just lightly hop from point to point. Yeah, you comfortable. I really want to stop, but I have more time. You got more time in this. Okay, yeah. Can you step on? You step on. Okay, step. You step on. Yeah. Yeah. So you can see where the laser. Don't press too much. Lightly touch it. Lightly hop. Yeah. Hey, okay, right? Yeah, so as I said, don't do the hairline because sometimes we never know that. So it might be more sensitive.
Sometimes the nose also.
Yeah, do the nose. Go for closing the nose. Yeah, it's okay. I mean, if the angle too over, it's okay lah. I mean, then you yeah. Sorry.
The skin stays not so big.
Yeah, that by itself, this laser doesn't cost too much maintenance by itself. It's okay. Yeah,
Which is quite
yeah.
second point.
I mean,
So that's all.
10 to yeah, that's already. Yeah. So you done half already.
So just do the whole face, focus on all in this order.
I mean, everybody has their own system, but the idea is to cover everything with
It
each.
is one this area,
I usually go to mouse.
one of them.
Yeah.
Yeah,
Yeah. So you touch up. No, the laser I don't do around the eye. Laser, so the only exception is laser around the eye I don't do, but the eye microneedling, you want to touch up, you eye. So you, so I said I want you the one. So it's actually I want the iron to lift up. The forehead also can touch up. You see, there's a lot of spots that like
The redness show
yeah. So that's why you come back for the touch up. So okay, fast away. I give you more time. I increase the time already. So usually what I do is I go and work on something else, then I come back and look for areas to touch up. So that you know yeah, we want to pull up the eyebrow first, then give you more space. Pull up the eyebrow, and then you just go under the eyebrow, you touch it, and then you sort of aim away a little bit away from the eye also, and you be flush with the thing. Okay. Yeah, but be flush also because if you're not if you're a bit tilted, your the needles may be too not attractive. Yeah. Then if you encounter just a pinpoint bleeding, it's quite okay. Okay. You encounter a bit of bleeding, right? You just put a little bit of pressure with a gauze and work on other places. It's fine. You will after 10 seconds you stop. Yeah, so you don't need to stop everything. Just work on other areas and press. So in total treatment, how many shots will you end up doing? Can you see shot count here? You've done half the face. Most of the time we're doing 500 to 600 per side per treatment lah. So at the end of the treatment, you usually will end up with about 500 600. That is easy to cover. It's enough to cover.
So she's the cover.
Yeah, she will cover. Okay.
So now this.
Yeah. Okay. So we hand over to Dr. Yeah.
Now this side. Oh, the machine this side.
It's okay. So just make yourself comfortable. Make sure that and all that is correct. Yeah. Okay, thanks for coming down. So you can adjust the chair to be comfortable.
I'm sorry, I take so long.
No, it's okay. It's
Oh, I'm sorry.
you okay. Then we maybe you design your face time.
Oh, okay.
I do the laser.
Then I'm watching
You watch
this.
it. I think it's
She's a very good subject. I think.
yeah. So usually you just start with the depth because you're going to start lower face, right? So you start with 5 and then after that next comes the energy. So the lower face, I mean she's experienced so so we can go on the higher 50%. First timer I will usually go 40%, but she done before lah. She can always do. Then we set the depth and we set the depth and there's a place to go to RF duration. So RF duration just take the depth 250. And then this delay time is the rest time in between is double of it, so it's 500. And then this is the rest time. So basically the needle will go in, fire for 250 milliseconds, rest for 500 milliseconds, then we track. So it's quite a long pulse. After that, this is the further delay time we have when the needle is retracted. So this is how long we have to get to the next position. So when you're starting up with a time, you can more cut down the delay time, the external delay time. Then, yeah. Okay. Sorry. Other than the lower. Yeah. Okay. I think you can space out a little bit more, don't overlap. Because if you overlap, there's a chance to over the areas of overlap. Yeah. Then you can, I mean, you miss out the spot, you can always touch up with that. But they can't space it. So along the cheekbone is where you might get some pushback. Of course, there's a bone there. So when that happens, of course, you just put a bit of pressure, slight lack of pressure. So along the cheekbones where you get a bit of pushback. So usually, A is you sure your face is okay, you're flush, and then sometimes it's just because the skin is thinned out in the area. Then that's when you really need that. Yeah. Or so usually for the 2.5 mm that I found that around the cheekbone you start to get pushback. Then usually that is the area where I just drop it to 1.5. It's okay. Yeah. Okay. So I did one pass. You can do for the second pass. Yeah. So sometimes so usually my left hand I'm usually holding a gauze. So if I see any human being I quickly press, then you will get a loose, and you need to keep the skin dry. If the skin is wet with blood or like sweat or what, like, it may affect the actually we just the skin dry. That's the usual advice. Okay, if you go for your second pass, then you can just touch up the areas of white spots in the blue, and then oh, oh yeah, this is useful. Yeah, I usually do until this area because the smash here can go out. But I avoid usually areas with hair or beard or what, like everything. So usually I'll avoid the hair. But I find that the area just the preauricular area, it gives a good lift. So I will usually target that all the way up to the ear. More or less, yeah, change that. We'll start with that. So we start with that. Drop the depth by 5. And then with less depth comes less power, right? So yeah. Yeah, 40 is okay. She done before, so if a new client 30 is reasonable. Right? For 40, she done before, so I think we can push her a little bit. Too expensive. Too expensive. So that's all of this. That's about it. So now I will do the. So I will do the neck lah. Yeah, for the neck. Yeah. You think you can do with your leg? Because it's a little bit awkward to like once you can master your left hand, okay, position. So Jack, come turn a bit, turn your chin a bit. Yeah. If I mean you'll be more comfortable if you can remain seated throughout. Because you don't want to strain too so. Now that you're comfortable with it, you can just step down and let it fire like shot by shot, and then it gets a bit smoother. Maybe why don't you work on the upper face first, and then we let the neck be turn red, and then we work on it. Yeah, nose is also more perfect, so let's do the nose. I mean, Jack has done.
No missing at all. 老将，你也是真老傻。
As long as you
That's the latest one, right? She went the big one. Now I see the number eyes.
you're overlapping a little bit again.
The witness very big.
You pull up the eyebrow, and then so you generally pull up the eyebrow to flash. This one don't rush because it's a bit flash, but don't press up the eyebrow there and aim a little bit away from the eye. Then you kind of you should just align it to the eyebrow, and then you just can go up a little bit and it's perfect. And this is part of that because you take a while to get the first time patient went off already. Take photo, bring her back here, we take photo of the nurse just to have it take okay. Then later we just remember to take photo of the witness. If you don't want to come back here, please take a thing just to so that we can just show her that the witness increased a lot after the thing. Please have your mind. Okay, so just have her she can go. We can arrange follow up. We should also do a follow up. We just do the follow up. For it. Yeah. Okay, it's not too bad. I think we can do one more pass for especially the little areas that have reached the end. Yeah. One pass. So the lower eyelid, usually we stretch the skin a little bit. Then you see this fine line, it's a good treatment for fine lines. You stretch it a little bit, then you can see. And usually I don't need to go so about half cm border is fine. But a lot of these fine lines can be a bit stubborn. So this is a good treatment. So for me, stretch down, we can do one. Good treatment for heavy orbital fine lines, which is a common reason. So the G can also do nasal level is good also. Often the pores are very big around. But I typically don't treat the upper and lower lid of heavy orbital heavy orbital area because it's a bit painful. So I usually don't. But you can usually I'll do that shit. But the the upper lid this area can be a bit painful. So I usually don't. But the nasal level part I will usually. I'm gonna go with 1.5 then that is a 1.5 footage. Okay.
Cartridge and thousand
Not really. Not really. But in reality, about after 1,000 shots, it will start to plant now. So, I mean, usually, effort a bit goes to use it and then keep it and then 1 month later, right? So, usually I single use. Yeah. And I mean, of course, single use, but if you want to reuse it, and we will usually sterilize a little bit. We will sterilize after then. When we collect. So, but if you find it getting down, I just change. The cartridge not so expensive. Because if it's too down, you may get like too much for that. Because it will go. Okay, so let's go to this. Okay, we're doing the same patterning laser now. Yeah, so this is a lowish conservative power, but it's okay because first, the laser can be a little bit uncomfortable. The laser is kind of there's a certain aiming distance. So usually I will get the spacer lightly touch. Yeah, because if you too high, too low painful. So usually I lightly touch and then I quickly but I skip. So it just the spacer will lightly touch. Yes. So basically every time you see it activate, you are putting one platform CL spot. Do you know fraction CO2? Yeah, but this one because it's not a basic you can if you I mean if you can really hit the same spot, but it's still okay. Yeah. This is myself is very gentle. You can see even if you treat the white area, like you will just kind of little bit thing on it. There's not too much. But I don't recommend it alone. I always use it as an adjunct to eye controlling. Alone, I haven't really, I don't think it's strong enough to think on its own. But I mean, it should help pause. Usually, open pause, I do recommend. You want to go one more pass? Or you comfortable? Okay, you got a feel of it. Okay. Thank you.
Wow, very good.
Yeah.
Destination.
Just touch up a bit of okay. Yeah, just touch up a little bit of then, yeah. Do a bit more on your jawline. So I just okay. Yeah, we bring you to go and we bring you to go and shine the LED. Yeah, but let's take photo. Yeah, I take photo of security. Just do for. Take photo together. I just want to.
People rate 这样。Okay, okay, smile. One, two, three. One, two. That's right.
Sorry?
Yeah.
Wait, we need to go and shine like. New subject from you. Okay, go ahead. Okay.
Yeah. Substitution, so not really,
Yeah.
anytime let's say it's fine. If you don't think it's fine.
I think, I mean, maybe the next thing I will discuss with Mark is to organize. So this is basically the standard treatment. This is like about 80% of the workload, like during the discuss. So substitution for people discuss body, something we can do with stretch marks, cellulite. And yeah, we can do a standard indication session. The next one. Yeah, I think so. I just share with you.